Good morning, boomers. Brian Tong here from boomerlife.net. I've been absent for a while because I've had the COVID. So I thought, well, what a perfect thing to post a blog about today. What is the latest COVID news from the CDC? We have updated isolation and quarantine recommendations from um, our illustrious leaders at the CDC. They do not apply to healthcare personnel and do not supersede state, local, tribal, or territorial laws, rules, or regulation. People with positive COVID 19 tests, the lucky few who can buy one, should isolate for 5 days. And if they are asymptomatic or their symptoms are resolving without fever for 24 hours, follow that by 5 days of wearing a mask when around others. Recommendations for people who are exposed to COVID 19 are also updated. If you're unvaccinated, or more than 6 months out from your second dose, or more than 2 months after the J&J vaccine, and you're not yet boosted, CDC recommends a quarantine for 5 days, followed by strict mask use for an additional 5 days. If a 5-day quarantine is not feasible, it is imperative that an exposed person wear a well-fitting mask at all times when around others for 10 days after exposure. People who have received their booster shot do not need to quarantine following an exposure, but should wear a mask for 10 days after the exposure. For all those exposed, best practice would also include a test for COVID at 5 days after exposure. If symptoms occur, officials should immediately quarantine until a negative test confirms symptoms are not attributable to COVID. Speaking from experience, I got my 2 Moderna shots in March and April. I got a booster in November along with a flu shot. And Christmas Day, me and my entire family, who are also vaccinated, got the COVID. Tested positive with home health tests, the ones we got from the drugstore. But after testing positive 3 times last week, we ran out, and now you can't find them anywhere. So I got tested at a public place this morning, and the tests aren't supposed to be out for up to 48 hours. So we'll see. Even though my exposure was December 23rd, which is 2 weeks ago, I'm still staying away from others and wearing a mask. So, what about children? The CDC is now saying everyone 5 or older should get a vaccine as soon as possible, free to all people living in the U.S., regardless of their insurance status. Check with your child's healthcare provider about whether they offer a COVID-19 vaccine. Check your local pharmacy's website to see if vaccine walk-in or appointments are available for children. I know the site I went to today at the Daytona International Speedway was not taking walk-ins. You had to have an appointment, but I made mine yesterday. So it can be done. The line it took me 40 minutes when I got in line, 10 minutes before my appointment, and I actually got my test 40 minutes later. So the line moved pretty fast. So what about booster shots? Vaccines are working well to protect against severe illness, hospitalization, and death, but effectiveness against infection decreases over time. And apparently I got the Omicron variant, and my symptoms were almost nil. Runny nose was all I had. The Omicron variant spreads more easily than the original virus. Boosters increase your protection, including variants. Get a booster shot 6 months after your Pfizer, Moderna, or 2 months after your Johnson & Johnson shot. Bring your COVID vaccine record to your booster shot appointment so they can add information about your booster dose. If you did not receive a card, contact the vaccination site where you got your first shot or your state health department to find out how to get a card. According to the CDC, masks help protect against the variants. You should continue to wear a mask in indoor public places or areas of high substantial community transmission, regardless of vaccination status. And I can tell you that regardless of the fact that I was triple vaccinated, I still got it. So basically, correct and consistent mask use is still being touted as a critical step everyone can take to prevent getting and spreading COVID. Masks work best when everyone wears them, but not all masks provide the same protection. When choosing a mask, look at how well it fits, how well it filters the air, and how many layers it has. The new recommendation is that you should be wearing an N95 mask. And if you need some, I provided a link below where you can buy them pretty cheaply, 50 of them for 60 something dollars. So it's not over yet, folks. Take care. Wear your masks when you can. And if you get the Rona, as my kids call it, stay indoors for 5 days and then try to get tested. That's it for Boomer Life from today. Have a good one. I'll see you on the flip.